individuals from various walks of life. She has been spreading awareness about heart health and lifestyle through various television channels, print media, health camps, other programs for corporate companies, education institutions, government bodies, and non-profit organizations. With this introduction, I hand over the mic to the Emeritus Professor, Professor Chokalingam, to chair the session and introduce about this program.
Dear friends, I'm really delighted to be a part of your nice organization. The topic what you have chosen is really very interesting. I'm really thankful for Dr. Saravanan Iyengar for this one. And I've been teaching for the last 53 years, but one pride for me is my students are all doing much better than me and giving happiness that Dr. Anantharaman and Priya Chokalingam joins with them to make me more happier. The COVID-19 is really very unfortunate thing happened, and globally it's redefined the life of everyone in every aspect. Now we are alive, and now sharing that platform itself is a gift for us because we lost many of our lives in that one. And we must start learning how life should be from tomorrow, and then we must learn to live with that. And really very interesting topic. Why I'm saying that, now the speakers and the topic for this is the concept of the heart. And the heart is the structure without any bone. The reason why it can work continuously 1 lakh times per day. Then imagine how many times it has to beat till you won't live, maybe even more than 100 years. In that way, I'm really happy Dr. Anantharaman is doing extremely good job, and soon many of his cardiac surgeons are very become enemy to him because he is going to replace cardiac surgeons in very many aspects in interventions, coronary, device closures, and many things. And he is really pioneering himself and is creating his own teachers in his turn. That way I am so happy. And Dr. Priya Chokalingam, not only my daughter, my student, and become my colleague, and she is doing a great job. And her aim was also rehabilitation. And I was discussing with her, whenever there is a place where we cannot habitate, we start habitating, that we call it as inhabitated. Once people start living in that one, and they will learn the art of the skills to become alive in that one is rehabilitation. But the person who learned to be in habilitating the particular circumstances, when they lose the skill because of fracture of your bone and joint or the heart attack, and they will lose the skill, we will make them to regain the skill of habilitating. That is what rehabilitation started. The rehabilitation is a very important aspect, especially for your field like bone and joints, and to as cardiologists. And the importance of rehabilitation is equally important than giving that intervention, making them all right. So they all play together, the concept of rehabilitation, and how important is she is really nicely stressing. And here in this point, I like to stress the most important thing you all will be knowing. Number one killer is the heart attack. Globally, I mean. 2 is the cancer. 3 is the accidents. And 4th now joint is the COVID. You will be surprised to know all the 4 killers, especially the prime killer heart attack, if a person decides to be, it can be prevented 100%. The reason why I'm saying this is also a part of a lifestyle disease. If a person is going to be very careful, they can prevent COVID 100%. Accidents, many cancers, heart attack, I'm very sure about it. How it can be prevented? All those who had a heart attack, how can recover totally and then come back to by rehabilitation back to normal? Please remember to my colleagues and friends, never lose peace of mind at any time of your life, and never lose your happiness. Happiness one can get only the platform of peace of mind. The person knows how to be at peace of mind and at happiness. All organs, especially heart, is ready to work for 100 years. Here in this context, I would like to stress here, globally, more so in Americans and Europeans, please remember, the burnout phenomena is becoming very, very extremely common, especially among doctors, more so among cardiologists. And you'll be quite surprised, the greatest tendency of suicide become more common among medical professions because they are not able to cope up with their workload. I request all my colleagues that you must be able to balance work and life constantly. You must take care of yourself first and take care of the society that is enlarged, depending on us. Most important one, and your topic of how you are going to be in COVID heart health. This period is very, very important. I think it will be very educative. And the message motto thing you are going to gain, maybe for us, you may best benefited. And please try to communicate the message of it in the simplest way possible to the society to understand how best you can be useful to them. As our Thiruvalluvar told very correctly, Noi Nadi, Noi Madal Nadi, Adithanikam, Vai Nadi, Vai Petsayar. You want to be the best doctor in any profession, not treating the patients of heart attack lakhs and lakhs. I'm very happy to be labeled as the best doctor if you're going to serve the society, how you are going to prevent number one killer disease, heart attack. The same thing, many of the things what you are facing as orthopedic people, the fractures, accidents, all those things is preventable. You must educate them so that they don't need the help of cardiologists or orthopedicians. Then you can be called as real doctors. That's what I used to say. All my friends, please avoid hurry, worry, curry to get buried. And COVID, I usually tell them, everyone, please remember, it can be prevented 100% the moment if you're going to follow SMS. SMS, I mean, soap and sanitizer, mask, social distance. Please get vaccinated at the earliest point possible so we all can be very healthy. Thereby, we can be useful to the society. So I conclude in saying that please follow 3 mantras. Be positive in thinking, be healthy in eating, be adequate in exercising. The 3 mantras will keep all organs keep moving and ready to work for us to live for 100 years. Thanks for this nice opportunity. I'm delighted to share my views in this August audience and this nice meeting. Thank you all very much. My best wishes to Dr. Anantharaman and Priya Chokalingam, and given the opportunity to share their interesting sessions. Thank you very much, Saravanan Iyengar. Best wishes for my colleagues. Thank you.
Thank you, sir. I'll share my screen.
Now we will now request Dr. Anantharaman. Anantharaman is going to give a talk on update on interventions and innovations in transcatheter heart therapies. It's a floor to Dr. Anantharaman.
Thank you, sir. And firstly, I'd like to thank Dr. Saravanan, Secretary of Tamil Nadu Orthopaedic Association, inviting us for the Bone and Joint Day and having a fantastic theme, Save Self and Save One for this year, which is very, very important because as medical professionals in this pandemic situation, it is very important to save ourselves. At the same time, we should educate and help the others to save themselves as well through basic life support and other measures. Now, the reason I've taken this particular topic is update on interventions and innovations in transcatheter heart therapies and hybrid procedures is very relevant to the COVID pandemic situation, which we are facing over the last 2 years. Now, the COVID-19 and heart, obviously the pandemic has changed the way we live, and there is a new norm that has come in and created on how we live how we practice medicine and how we practice interventional cardiology and surgery as well. Now, people with pre-existing heart disease, they are more severely affected when they acquire COVID. Now, COVID-19 affected the heart in many more ways than you can think. Patients had heart attack, patients had heart failure, patients had myocarditis, acute as well as subacute, arrhythmias and sudden deaths, and multiple venous and arterial thrombosis. Now, during this COVID situation, a lot of patients were concerned about coming to hospital and died at home. A lot of them, when they came to hospital, the cardiac interventions and surgery became difficult because of so many restrictions and limitations in resource allocations like ICU beds, ventilators, staff shortage, oxygen shortage, regular requirements increasing. So all this meant that we have to adapt an innovative approach to save these patients' lives using the technological developments and the available transcatheter procedures as an alternative or lower risk alternative for the standard surgical procedures. Now, as my professor has already told, these are two important sort of verses from Thirukural. One is Noi Nadi, Noi Mudal Nadi, Aditanika, Vai Nadi, Vai Pachai. First, we need to understand about the disease, and we need to understand the root cause of it. Then we need to identify the ways of treating it and how it should be treated. But more than that, this is more relevant to the COVID situation. Utran alavum, pinialavum, kalamum, katshan kardi seyal. What it means is, more than the disease, you need to understand about the patient, patient's age, a patient's condition, and the currently prevailing situation in the pandemic, rather than approaching in a standard way like surgery is the option, because patients need to stay in hospital after cardiac surgery for more than 7 to 10 days. ICU beds are limited, ventilators are limited. That means the patients were not able to get the surgeries done in time, and they were dying at home or otherwise. So alternative approaches has to be found out. Now, our forefathers were very kind of educated as well as able to predict that if you are in good lifestyle and if you can lead a good lifestyle, then you can prevent most diseases. Later on, the English literature has found, and Heberden has mentioned about this angina, that is chest pain, in 1770s. And he said by doing regular exercise, you can avoid getting these pains. But even before that, even in 600 BC, this has been reported by Sushruta in his Ritishula. And also he went on to say that by doing regular physical exercise, you can avoid getting this diabetes. And we are in the middle of the epidemic of diabetes and coronary artery disease because we fail to follow this or understand this. And this is where we are now. In terms of the statistics, we are the world leaders of diabetes, hypertension, and heart disease. And Dr. Priya Chokalingam will talk more about this on prevention and rehabilitation. So the heart disease, obviously, we have coronaries, valve disease, myocarditis, pericarditis, arrhythmias, congenital heart disease, inherited, and others. So more sort of training to this COVID situation, what are the innovations that help us or helped us to treat these patients more effectively? First one is about the valve disease and the aortic disease. Now, conventionally, surgery used to be the treatment of choice. Even in the normal situations, about 30% of the patients were not getting surgery because of their age and other comorbidities. And in this COVID pandemic, more than 50 to 60% were not able to get surgeries done because of the other shortages like ICUs, ventilator beds, and all the others. So transcatheter therapy seemed to be the best alternative in terms of treating these patients and saving their lives with a very minimally access through the right femoral or right subclavian approach. And during COVID pandemic, I have traveled across the country to many states and many places and doing these procedures, and we have saved many lives through this procedure. So what is this transcatheter heart valve therapy? This is one case example, 81-year-old female, multiple comorbidities, previously replaced surgical bioprosthetic valve 2004 and had multiple other comorbidities, breast cancer and other things. Now she represented with a severe restenosis. Surgery was not possible. So the only alternative was to put a new valve in the previous valve through the transcatheter approach. So this is how it is done. A wire is placed, a tube is placed in the groin, and over the tube, the valve, which is crimped inside a stent, is taken and put inside the failing previous valve, and immediately it starts functioning. And these patients can be discharged the very next day without needing for any ICU support. And this multiple procedures and multiple lives were saved during the COVID pandemic by this transcatheter valve replacement procedure. And this is published in all the papers and literatures. Now, we have also pioneered in India, and myself and Dr. Chokalingam, this was the first in man proof of feasibility of replacing a valve as well as the aorta in patient with severely affected arterial disease of the peripheries. So you don't have an access to replace these valves. So the other alternative is you go through the vein, that is IVC, and cross over to the artery in the abdomen and then replace it, and on the way back you close that. And this is the first case in the world, the first in man proof of feasibility case, which was done by us during this COVID time, and the patient did well. Now, we also initiated an awareness program, and for that a Guinness World Record was officially documented, increasing awareness through doing multiple centers, 20 centers, TAVI procedure throughout the world. Now, what about the treatment for coronary artery disease? What are the innovations and how did it help during this COVID time? So one of the innovations was the laser coronary atherectomy. Laser is new in India, but we have been using that for almost 10 years in UK before I left from there. And how does the laser work? Obviously, this is a machine and it's a cool laser, and it works through three different phenomena. Photochemical, that means it dissolves the molecular bonds between these cholesterol molecules or thrombus molecules. Through photo energy, it lyses it, and also kinetic energy dissolves it. So it works fantastically in atherosclerotic, calcified, as well as thrombotic blocks. And this was the first case in South India, which was performed during this COVID time in a patient who came in with cardiogenic shock, and none of the treatments was working. And when we did the laser, the patient's blood flow was restored, and on third day, he was shifted to ward, and on fourth day, he was discharged. Otherwise, he would have died in the hospital without the availability of this treatment. So basically, that was his angiogram. That is a blocked left system. Right system was fine. And usually we aspirate clot. So that is what is done here. Following aspiration of the clot, there was no blood flow restored. Then ballooning was done. After ballooning again, there was no blood flow restored. So all the normal procedures did not work. Then we opted and I used a laser to ablate the thrombus as well as the plaque. It is a slow ablation process. Following ablation with laser, this was the start, and this was lasering, and after that, the blood flow was restored. It was a huge blood vessel, as you can see from there. Blood flow was restored, and he was discharged. So this is a life-saving procedure in these patients with a high thrombus burden. The other one that has come up is what we called shockwave lithotripsy. Obviously, you would have heard about breaking the kidney stones with ultrasound, that is lithotripsy. Same thing is now available for the heart. It's mounted on the balloon. It's got emitters, ultrasound emitters. When you cross the narrowing with heavy calcification in the blood vessel, this is an OCT image showing heavy calcification. The ultrasound impulses emitted will crack the calcium and through the pressure waveforms and create enough space for you to dilate and put stent. And this has become a lifesaver during this COVID times. Otherwise, we would have been using rotablation, drilling, and also all the other things. What about complex cardiac procedures? Was it performed or was it not? Now, we have had several patients with multiple cardiac pathologies, especially COVID-related as well. And the availability of hybrid cath lab operating room in Kaveri made that we could do surgery as well as intervention at the same time. This 74-year-old male, diabetic, hypertensive, old inferior MI, severe TR with PH, and recent fall, he also had a cerebral edema as well. He had a slow heart rate, and higher degree heart block as well. He had restenosis of the right coronary. Saravanan, can you hear me?
Yes.
Good. Now, we had a detailed heart team discussion, and you have to do 4 different procedures. And the patient's family was not keen to have 4 admissions and 4 different procedures. So after a detailed heart team discussion, we decided to do in a single procedure an image-guided PCI, flutter ablation, appendage closure, because patients who are having bleeding as well as irregular heart rhythm with stroke due to clot, it is very difficult. And the major clot comes from the appendage. So if you close that, the risk will be reduced. And then pacemaker for the slow heart rate. So this is what it was done. That is the angioplasty stenting, and that is the OCT imaging, showing the stent is very nicely apposed. Following that, a CT fusion in the hybrid cath lab was used for ablation procedure, and the flutter was ablated. Following that, this is what I was alluding to. The appendage is where the clot forms, and the appendage was closed with the device. It's called the appendage closure device. As you can see here in fluoroscopy, it's a dumbbell shape as well as the disc there. And that is how the echo looks. There is no color going into the appendage. So the appendage was closed, and following that, pacemaker was implanted. So all 4 was done in 4 hours total procedure time in a single hybrid operating room. And the patient walked after 1 week and is doing well. So these kind of complex procedures were made possible because of the availability of the equipment, technology, and infrastructure. And that is the team who performed it. Also, previously operated patients, ascending aortic aneurysms, leaking, normally surgery is performed, and surgery is always very high risk. And this COVID situation, it is much higher risk. So transcatheter closure is an option. This is a patient who had about 7 years later a leaking pseudoaneurysm, is only 44, and severe aortic regurgitation. This is the pseudoaneurysm. This CT image shows that is the Dacron graft, distal anastomotic point. There is a neck and a huge pseudoaneurysm or false aneurysm, you call it, and it's filling rapidly. If you don't treat it, it will burst. So it was closed by percutaneous means. A tube was put in, pigtail catheter, wire, and that a long sheath. And then this is an ASD closure device which was implanted across the neck of that pseudoaneurysm and completely sealing that, and patient did well. So all these complex procedures were not cancelled, were performed successfully through a transcatheter procedure, and patient is doing well. Now, other thing which was done during these times was hybrid surgery. So what is hybrid surgery? Normally when we do bypass, this is the first hybrid coronary artery surgery in India. First single stage hybrid surgery, because it was possible because of the hybrid operating room. So normally the surgery is done with 1 mammary artery graft and then 2 vein grafts from the legs. But obviously hybrid means through the left thoracotomy mammary will be done, for the other lesion stenting will be done. Is there a need to do that? So this is it. This left thoracotomy without opening sternum, bypass is done, and then stenting is done in the same table. But what is the need for this? The need for this is the left internal mammary artery graft at 10 years, 90% will be still open. But the vein grafts normally which we use, about only 40% of them will be open. And these drug-eluting stents, about 85% of them will be open. So if you combine the best, the Lima graft and the drug-eluting stent, then you are doing the best for the patient. But more than this, during this COVID times, the patient's hospital stay is reduced to 3 days, 1 day ICU and 2 days in the ward, rather than the normal 5 to 10 days. And the infection risk is reduced and overall mortality is reduced. So we have done several of these hybrid CABG and stenting procedures and discharged them within 3 days. And patients are doing well, aging from 30 up to 79 years. So this hybrid CABG has been a lifesaver during this COVID-19. And also there are other hybrid procedures that is done for complex congenital heart disease as well. This is one particular patient who had coarctation of aorta, ventricular septal defect, patent ductus arteriosus, as well as atrial fibrillation and moderate severe mitral stenosis due to a supramitral ring. So the patient underwent a transcatheter treatment for the coarctation. You can see a very tight narrowing in the aorta, which is the coarctation, which is stented. Following the stenting, immediately he was shifted to the theater, and the mitral stenosis, that supramitral ring, was resected, and patient did well, and he was transferred to CCU and discharged on third day. So multiple hybrid procedures like this were performed during this COVID-19, saving lives. More than that, some of these young patients had myocarditis and they came very sick. And now the percutaneous assist device, it sucks out the blood from left ventricle and pumps out into the aorta. This is one case which was done. This is Asia Pacific's first case for this kind of device-supported recovery of myocarditis. Patient is 18-year-old. He had out-of-hospital cardiac arrest while he was playing 30th of May during this COVID pandemic. VT arrest, resuscitated. He was brought to one hospital, and then from there he was transferred to us. He was very sick. Lactate was very high. He was almost dead. And that is his LV, very severely affected. So after detailed assessment, we implanted that Impella device. And this is how it is done. The Impella and the X-ray next day looked much clearer. And the heart function started to recover on the third day. It was 48%. And before discharge, it was 50%. So patient's heart recovered. MRI showed hypoxic injury, which was gradually recovering. And also CT chest showed 50% lung involvement. So he had a tracheostomy and a neurorehabilitation. So this mechanical circulatory support device was a life-saving treatment in this patient and for multiple other patients during this COVID. The upcoming treatments are renal denervation for resistant hypertension. So the key message is COVID-19 had created a new normal for how we treat our patients, how we save ourselves and our team while saving patients' lives. So the innovations and technological developments, as well as the expertise and the infrastructure, made it possible that these lesser invasive interventions are possible in India as well, and patients' lives could be saved. The only downside is currently the cost as well as the awareness. If we can deal with the cost and get the cost down, and if we can increase the awareness, then a lot more patients will benefit from this. Thank you. As Professor has already said, make sure you all get vaccinated because that is the only lifesaver in this COVID to stop the spread. Thank you.
Dr. Anantharaman, your excellent presentation, my greatest appreciation, and really a great treat for me to listen what you have been doing, and is eye-opener for not only all cardiologists or interventionalists also, and you are making your job more easier by means of your and technique and involvement for your profession. I really appreciate, and definitely more and more things are going to come. In question of time, you can replace, as I told you initially, surgeons. My greatest appreciation, Anantharaman, and your job is excellent, and excellent presentation. You all must give a very big hands. And if you're going to a real physical meeting, I would have made them to give a standing ovation. Thank you. Thank you.
Thank you.
Next, we will go on to Dr. Priya Chokalingam, and she is going to talk on prevention and rehabilitation, pillars of heart health, especially in the present COVID scenario. Floor to Priya Chokalingam.
Good evening, one and all. Thank you for the lovely introduction. It was amazing to see all the cutting edge technology that has been applied, particularly in these challenging times during the COVID pandemic. Thank you, Dr. Anantharaman, for walking us through that exemplary work that's going on. And I'm really thankful to the organizers, particularly Dr. Saravanan, and for this wonderful opportunity to meet my professors, my colleagues and friends in the field of orthopedics this evening. Thank you also to Dr. Anantharaman for having me chip in to talk about prevention and rehabilitation. How are they the pillars of heart health? So let me share my slides. You're able to see my slides in full screen, right? Great. So we will be talking a little bit about the disease burden. It has already been alluded to. What are the cardiovascular disease risk factors that we should all know about? And what is the role of cardiac rehab in the prevention and reversal of heart diseases? And of course, some important and interesting tips for each and every one of you to take away this evening. So if you look at the global health trends currently, we are at the cusp of both infectious diseases and lifestyle diseases. So lifestyle diseases, cardiovascular diseases are the most common killer diseases. So they are basically diseases of the heart and blood vessels. And now we know that infectious diseases for the last couple of years have been wreaking havoc. So the COVID-19 is a major virus that's posing a big threat to humanity. So we now know that more than 19 crores are affected globally with this COVID-19. And unfortunately, over 40 lakh people have died to this, succumbed to this virus. What we probably might not know is more than 50 crore people are affected with cardiovascular diseases. This is probably still an understatement. And more than 2 crore people die annually from these cardiovascular diseases. The leading causes of death in both men and women, if you were to look at the top 10 as the top 10 causes of death, these are US statistics, but I would presume they are very similar to developing countries as well. So we have heart disease, that is myocardial infarction, as the leading topmost cause of death. And also as introduced by our chairperson, we also have cancers, we have diabetes, we have other illnesses which follow suit, but in both men and women. So this is an important message that we need to communicate to our society, that even cancers in women are only secondary to heart attack as a leading cause of death. And very unfortunate to see that the age of the first heart attack is rapidly decreasing. So if we take 100 patients who present with a first myocardial infarction, about a quarter of them, almost 25 to 30% of them, are below the age of 40 years. And this is very specific for developing countries and more so India. So we are almost 20 years younger than our Western counterparts when it comes to our first myocardial infarction or heart attack. So this is extremely important as a statistic to be aware of. And I'm sure quite a lot of our young orthopedic colleagues are here in this audience, and they should also take note of this. And the Indian diaspora, that is our community, the Indian population spread all over the world, are showing similar trends. So this is something we need to also keep in mind. And this chart here shows the global distribution of ischemic heart disease. The top panel is in men, and the bottom panel is in women. So what you have to just look at is all the dark red or maroon. All these areas are the very heavily burdened regions. So India is right here. So in both men and women, this is a very big economical as well as a health burden for our country. So switching gears to the risk factors. So we all have learned in our medical school about the modifiable and the non-modifiable risk factors for heart diseases. But now this rubric of these 9 important lifestyle risk factors, this came to be known after the, of course, Framingham important studies like the Framingham Interheart study, etc. So the most important ones are unhealthy diet, lack of exercise, and obesity. They form the basic reasons for why people end up with, let's say, high blood pressure, high blood sugar, and abnormal cholesterol. And of course, in the middle row, we have the addictions like smoking and excessive alcohol use, smoking in any form, in any form of tobacco, either in cigarettes or snuff, any form of tobacco, as well as active and passive smoking are very hazardous. And right in the middle of this rubric is the psychosocial factors or the chronic mental stress, which again is an important risk factor, an independent risk factor for cardiovascular diseases. So all these 9 risk factors are independent risk factors, and when an individual presents with 3 or 4 or multiple of these risk factors, their risk of a heart attack or a stroke becomes so much more higher. And what is this Masala study group? That is basically mediators of atherosclerosis in Asians living in the Americas. So basically, our population living settled in North America. So again, the risk of heart disease is very high at a young age in that population as well. So I would like to allude to this concept of lifestyle versus genes. So we all ask for family history. We know that diabetes, even hypertension, cardiovascular diseases also have an inheritable component, that is the genetic predisposition. But what we know is now that lifestyle factors play a very, very major role. So this concept of epigenetics, particularly in heart diseases, has picked up. It has gained a lot of traction, and massive amounts of research is being conducted in this area. So basically what it says is, unless we have our unhealthy lifestyle also contributing, it's unlikely that our genetic predisposition will actually manifest as a cardiovascular disease. So the bottom line is age, gender, and even family history can be overruled by a healthy lifestyle. So epigenetics is an evolving new concept, and please look it up for those of you who are interested. We all know about the 3 silent killers. So we know that high BP or hypertension, unless we, have it regularly checked, it is very often missed, easy to miss. The same thing with dyslipidemias. We know that we should have our total cholesterol, our LDLs and triglycerides under control. Our HDL, the good cholesterol, should be 40 or higher. And diabetes. Again, we are the global leaders in diabetes. So what we need to know is try to have the fasting blood sugar less than 100, and the HbA1c in diabetics preferably less than 6.5. So the 3 silent killers, diabetes, hypertension, and dyslipidemia, contribute a lot to the cardiovascular diseases. What about body mass index? So as orthopedicians, you all would very well know about this concept of BMI. We should try to keep our BMI below 25, ideally even below 23.5 for South Asians. And moving on to a few simple tips and tricks on, dietary aspects and exercise. So it is very important to look at what we consume on a daily basis. So this chart here again shows that on a daily basis, we are consuming much lesser amounts of vegetables, fruits, the dairies, the healthy oils, fiber, etc. So all these are our important nutritional requirements, and we are falling short of the daily goal. Whereas those that we are exceeding the limit are the unsaturated or the saturated fats, that is the unhealthy fats, the refined grains, that is the polished and refined grains, a lot of salt in our diet, much more than we actually require. So all these things we are exceeding the allowance. So how do we balance it out? So we have to make sure that we consume a lot of the naturally available fruits and vegetables, then have a daily requirement of our carbohydrates in terms of whole grain products if possible, and then move on to our dairy and protein-rich sources, whether vegetarian or non-vegetarian sources, and then have minimal amounts of the high-fat foods, the oils and the bakery products, sweet dishes. All of this should be very, very minimal. This concept brought out by Harvard is a very interesting and a useful one. So every time we pick up a plate to eat, so make sure that half your plate is filled with some form of vegetables, maybe salads, maybe our daily side dishes, our gravies, some amount of fruits. So 1/2 is filled with fruits and vegetables, 1/4 with whole grain products. Maybe it's your whole grain rotis or your whole brown breads, your whole unpolished red rice, brown rice, whatever you can get hold of, your millets. These are all good sources of whole grains. And another 1/4 by your healthy proteins, be it vegetarian or non-vegetarian sources. And we should have healthy oils, that is vegetable-based oils, in very small amounts. We do not need large portions of oils in our diet, very small amounts, and avoid reusing preheated or pre-cooked oil, and sufficient amount of water. So I think this healthy eating plate concept, if we can try to stick to it on most days when we pick up a plate to eat, will give us a very healthy and balanced diet. And I do not need to stress about the importance of exercise to this one August audience here. But what we have seen, as shown in this graph here, is that India is lagging terribly behind in the levels of physical activity that we need to meet on a weekly basis. So in dark red, so some South American countries you see are also lagging behind. So how do we know if our exercise is adequate? So we need to have at least 30 minutes of moderate to high intensity aerobic activity on 5 days of the week, totaling to about 150 minutes per week. Or if you're somebody who likes to do vigorous aerobic activity, then you can stick to about 25 minutes on 3 days a week. There's about 75 minutes of vigorous activity if you're somebody who likes to run or swim, laps, those kind of vigorous activity. Or you have to have a combination of these two and also complement it with muscle strengthening exercises on 2 days of the week, at least 2 to 3 days of the week. So this is a right combination. So a good amount of brisk aerobic activity and muscle strengthening exercises on a daily or a weekly basis. And the principle that is most often applied here, the FIT principle, where you look at how frequent are you exercising, let's say 5 days a week, how intense is your exercise, how much are you sweating out or working out, how long is each session, that is the time, and what type of exercise. Is it aerobic, is it muscle strengthening, is it let's say balance or flexibility exercises like yoga. So this principle called the FIT, F-I-T-T, will help you have an overall idea of each and every session of workout that you're involved in. And what we often say to our patients or clients is make sure you enjoy the exercise that you're doing so that we do not have to be always motivating you to be regular at your exercise. If you enjoy some activity, then your long-term adherence is going to be great. You're not going to give up walking or cycling or even jogging if you're addicted to it, right? So I think that's a very important principle. We can help. As Dr. Anantharaman said, they've been doing a lot of wonderful work, that high-end technology, but then the patients are referred to us for cardiac rehabilitation, and then we go back to the basics, the fundamental concepts, and they're able to adhere to all these lifestyle changes. And it's great to see that it's a very rewarding experience for them and for us as a cardiac rehab team as well. During the COVID period, we couldn't have stressed more. People were not able to go out, even people who were really regular exercisers who used to either walk at a park or a beach or even around their colony. They felt crippled. They felt like they were stuck indoors. Suddenly everything was shut down and they did not know how to even use up their energy. So simple tips to exercise at home using their own body weight exercises, or if they had access to staircase where they were asked to mask up appropriately and try to use the staircase or walk up to the terrace back and forth. So very simple things, but when actually implemented has a wonderful impact on the functional capacity and the mindset of the patients as well. And as people are now heading back to work in the almost the post-pandemic period, now offices have begun. So we implore them to make some positive changes at work. So if they're more of a desk job, we suggest that they try to stand and take their meetings or have walking meetings. In fact, just drinking a lot of water in between their work hours helps them to get up and walk around and even walk to the loo, if not anywhere else, or they walk around to say hello to their colleagues. So all of this has changed a little bit. The social distancing definitely has changed how we would have interacted with the rest of our members, but still most of it is doable and possible. And I definitely need not go through the long list of benefits of exercise. Each and every one of you is aware of that. But the most important thing here is it also releases, exercise also releases all the happy hormones. So we know that it elevates our mood, especially we need that mood elevation and that boost to our energy in these troubling times. So let us all make exercise a habit and follow it strictly. That last bit is going to be about the mind-heart connection, and I'll also talk about rehab and wind up with that. So we know that stressors and stress are slightly different. So whatever pressure comes from outside, we call that as the stressors or the triggers. And how our body and mind responds to this is known as the actual stress response. So if we are able to look at these as two different things, it's much more easier to manage our response to these stresses. And there's a long list of behavioral risk factors, starting from physical to negative emotions to chronic stress and even caregiver strain. So while we rehabilitate the cardiac patient, we also give equal importance to counsel and help rehabilitate the family of the cardiac patient, that is the caregivers. And as Professor Chokalingam alluded to, burnout is becoming more and more common in doctors. So there is a recent study which came out from Tamil Nadu, which showed that doctors are at a higher risk of burnout compared to even the nurses and, of course, the general population. So definitely, I think the work-life balance is a key here. We need to learn to manage our stresses in the work.
Yeah, thank you very much for the nice presentation, Madam and Dr. Anantharaman. Since there is no question came from the audience, Madam, kindly explain about your this one hot survey which we have shared with our members. Kindly
Yes.
explain about
Good
the
evening.
survey.
Good evening, Dr. Saravanan. Was there some problem with the rest of the slides? Was it not played fully, my recording? I think there was some interruption, right, in the slideshow. Can you hear me? Am I audible?
Yeah, yes, Madam.
Yeah, okay. So thank you for having me participate in this wonderful heart health awareness program. And thank you to all the survey respondents. We had about 25 of you responding to the heart health survey. It showed us that a few things. We were trying to assess the intake of fruits and vegetables, you would have seen, and then the intake of whole grains in your diet. So what we noticed was more than half of you. Yeah, I think they're able to play the slide again. Shall I continue with the survey after the slides? Are they playing the slides, Dr. Saravanan?
Yes, madam.
Previous slides, I think 2-3 slides before this. So, yeah, you can play from here. Yes. It's okay. You've gone back. You can go a little bit ahead. We have finished all of this. We were talking about, yeah, this is fine. You can play it here. Can you play it, please?
It's on, doctor. It's on.
No, but the volume is not coming.
Able to hear, doctor.
No, there is no volume. The volume has stopped.
Okay. I'll stop and share again. Yeah, I'll stop and share again.
No, there is no volume.
Recharged and up and running. We need to have our me time every day, probably
Now
just
it's
10
coming?
to 20 minutes if possible to
Yes,
reflect
yes.
and recharge. And definitely staying away from tobacco and alcohol, because these definitely would not be good coping mechanisms for stress. And I can assure you that when we set goals, whether it is health goals or any specific lifestyle goals, it needs to be small steps, baby steps, as we call it. We encourage our clients to set SMART goals. That is, each goal should be specific, measurable, attainable, relevant, and time bound. So only when each small goal is a SMART goal and you start attaining it week after week, then the possibility or the chances of achieving a bigger health goal of maybe getting fit, or maybe it's running a marathon, it could be anything. So whatever your health goal, break it up into SMART goals, small short steps that you can easily achieve and reinforce yourself. So the last but not the least, what is cardiac rehabilitation? So quite often cardiac patients have a lot of questions, particularly why did it happen to me? Can I get back to work? They're very worried. I mean, people are around them are telling them not to eat certain foods, not to be active, just to stay home. They have a lot of needs as well as to reliable answers for their questions, and they need evidence-based advice. So we need to provide a holistic approach, and that is what cardiac rehabilitation is all about. It's a medically supervised program to help improve the health and well-being of people with heart problems. And it's a combination of exercise, education, and counseling to reduce stress and help people return to active life. There's a whole gamut of cardiovascular diseases where cardiac rehab is indicated. So we know that heart attack, even heart failure these days, stable heart failure is definitely an indication for cardiac rehab. People have, there's evidence to show that the ejection fraction improves with supervised cardiac rehab programs. We have all our surgical patients who are benefiting from cardiac rehab. That even includes heart and lung transplant patients. And it is definitely an interdisciplinary management. It cannot be done by a single individual. We have right from the physician, the exercise specialists, the dietary experts, and the psychosocial counselors involved in a cardiac rehab team. And it is performed in phases. So typically the 2 to 3 month or even the 4-month hospital-based or outpatient rehab program. This phase is after somebody has been discharged from hospital. This 3 to 6 month phase is very important, as in to rehabilitate them and get them back to a normal, healthy living, and then follow them up in the phase 4. Of course, it has to be complemented with optimal medical therapy. No two questions about that. And we are happy to have had some important publications from our population where we have shown that internationally developed cardiac rehab programs also work in our population, provided they are tailored to our sociocultural and psychological needs of our patients. We've had the opportunity to also show that there is remarkable regression of coronary atherosclerosis with a combination of pharmacotherapy and lifestyle modification. So there are multiple benefits of cardiac rehab. It lowers the chances of a repeat heart attack or a repeat procedure. It reduces the overall risk of death and morbidity as well. Angina and several symptoms come down. It controls all the cardiovascular risk factors. It helps with weight loss and psychosocial issues. So we're also currently working on home-based cardiovascular prevention programs, and I'm extremely thankful to Dr. Anantharaman for collaborating with us on how home-based cardiovascular prevention programs during the COVID-19 pandemic has proven very effective in our population. So before ending, we all know that lifestyle, genes, and environment play an important contributing role to our heart diseases. The risk of heart diseases is real in each one of us. We need to have a prevention mindset, and regression and reversal are not far away. They are definitely proven, and it's important to have fun as we journey along this healthy lifestyle process. So thank you very much for this kind listening. I'm really glad to have been a part of this wonderful celebration, and thank you very much.
Priya, I really appreciate for this excellent presentation, and you have covered most of the topics what you really want to do for our society. If everyone follows Priya's principles and taking some message of Anantharaman and Chokalingam, who will become jobless. That is what you must go and direction of our journey is. And whatever thing you may do, Anantharaman or Chokalingam, please remember, anything intervention is only temporary. Permanent thing is what we are saying in rehabilitation, how they are going to take up the life further. So they really play a very important role. In future, artificial intelligence and gene therapy for gene coding, gene decoding and gene recoding is going to come in in the recent future. It will become definitely possible. So it may replace all our concepts of therapy. Also, gene therapy is going to come up. And really I appreciate Anandra once again. Priya, you said one Harvard dish what you are going to give. Please remember, the full dish must be only half of your stomach. The quarter stomach must be water, quarter stomach must be empty all the time. And exercise is a must. Even today I am in the 9th floor of cardiology department. I never used the lift to go up to my room. Till today I am using only the staircase to go up to 9th floor. One day one new liftman came, Sasa, why don't you come by lift? Surround that person asked me, I told him, yes sir, you lift la varakudada. Tondra pannadinga enna. Lift la vaanga sir, mele seekiram poyidalam. Mele seekiram pogakudadu enbadharkkagathaan I am in practicing my exercise as a part of our life itself. That is going to strengthen your bone and joint. And most important to conclude, please remember, to be very happy is the keys of happiness only in your fingertips as you operate the computer. The fingertips operate the computer. One, control yourself. Alternate if necessary. Delete the unwanted things. You are left only the happiness. So be happy and be healthy. No two opinion about it. And thanks for this nice opportunity. I really once again appreciate my colleague and my professor Anantharaman and Dr. Priya Chokalingam for the excellent sharing of that knowledge. Thank you, Saravanan and Iyengar. Thank you very much.
Thank you, sir.
Thank you.
Thank you, sir. Thank you, sir. Madam, we have a question in the question and answer box. Dr. Sekhar has asked a question. Post-ischemic exercises, which is ideal?
Yeah, wonderful question, Dr. Sekhar. So post ischemia, depending on the either medical management or particular procedures, so they have to take it very gradually in a stepwise manner. So after, let's say, angioplasty or something, we can start cardiac rehab within the first week. But after, if it is a bypass surgery, open surgery particularly, then it takes a few weeks for the patients to recover to get back. So in that case, if it is CABG, in that case, then the advice is slightly different to continue with their activities of daily living for the first few weeks, and then after a 3 to 4 week period, they are ready to start their cardiac rehab program. So the ideal exercises would be to start with what they have been doing for their activities of daily living, like particularly walking, some amount of stair climbing gradually. So I think initially it's walking, it's first activities of daily living, and then walking as in slow walking with short bouts. We take it as bouts of 10 to 15 minutes, maybe 2 to 3 times a day to begin with, depending on how their heart rate and BP is responding to this exercise. And then slowly to increase the intensity to within home exercises like step ups or stair climbing. And based on that, again, see, when they're on a cardiac rehab program, we have a very close supervision. We are monitoring them almost 2 to 3 times a week. They have supervised sessions with the rehab team. So we very well know how the patient is responding to these exercises. But if they're not in a rehab program, then I would say it's ideal to go slowly, start with aerobic exercises for the first 2 to 3 months, go gradually increase the intensity. And after that, again, with, if possible, the advice of exercise specialist, start with strength training exercises. So this is the recommendation as of now.
Thank you, madam. Another question from Dr. Dhansekhar Raja. How important is isolated high LDL level or statins required? How strict should be the LDL control?
Yeah, again, important question. So the low density lipoproteins, we ideally would like to keep the level below 100. At least, we have to bring the level down. In all cardiac patients, it is important to keep them on statin therapy. So in the optimal medical therapy, the statins do play an important role, right? So we have to bring down their LDL levels to about at least by about 20 to 30% from where they started. So ideally, it should come down below 100. So in our population, we see that LDL and even triglycerides is quite high. It's above 150 or even above 200 in many of our patients. And we often quite often see that the HDL levels are quite low in our patients as well. So again, that is something we work on through lifestyle. So when they start doing exercises and they start leading a healthy lifestyle, we see that there is a gradual increase in HDL levels as well. So as you rightly said, LDL, we have to bring it down. We use statins for that. And the ideal is to bring it below 100.
Yeah, thank you, madam. Dr. Anantharaman, do you want to convey your message to our distinguished members?
And before that, as I was talking about the survey, the most important takeaway point is predominantly majority of the survey respondents have to work on their intake of whole grains. So the recommendation is to have at least one meal every day, which includes whole grain products like, let's say, brown rice or whole grain rice or whole wheat rotis, chapatis, bread, your millets. All of these are whole grains. And then the intake of fruits and vegetables combined should be at least 5 cups per day. Most of the respondents have replied that they take about 2 to 3 cups per day, which is insufficient. At least 5 cups combined of fruits and vegetables we have to aim for. And when it came to exercise, many of them were not meeting the requirement of at least 5 days a week of brisk aerobic activity and strength training activity. We have to look into that. And the other aspect that we noted was almost half the participants self-reported that they had chronic stress. So if you could start managing your stress better, practicing some stress management techniques, that will be very useful. Quite a few of them had reported that they were getting sufficient sleep. But when we asked about active hobbies, so some of you have mentioned listening to music or reading or watching television. All these are not active hobbies. So it is active hobbies are something where we are also active, moving around. So gardening, any sports, dancing, all of these would be active hobbies. So try to have an active hobby that you enjoy doing. And you all had some nice health goals that you're aspiring to achieve. So I would really wish all of you that you start working towards those goals, take small steps, and you will definitely reach your goals. Thanks once again for participating in the survey.
Thank you, Priya. And firstly, thank you, Saravana. Thank you for this wonderful opportunity on the Bone and Joint Day. It was a pleasure to be part of it. And my apologies that I couldn't join early. I was at an emergency case, ECMO case. I'm in the ICU now. Now, the theme you had this year was fantastic. Save self and save one. It's very, very important as medical professionals, especially cardiologists and orthopedicians. Obviously, we are at a very high risk during this COVID pandemic. And it's very important to remember that apart from your profession, there is a family at home. So it's very important to save yourself. So save self is a very important motto, as Saravanan has put, and also save one. So while at work, make sure that you are having adequate precautions, PPEs, all those things when you are doing the procedures. And also take some time to look after yourself, proper diet and proper exercise, and avoiding as much as possible smoking and other things. Now, technology is improving all the time, and there are new techniques, technological innovations, which is helping us to overcome this pandemic. But still, we are not out of it. So, vaccination is very, very important. So, I request all our colleagues to make sure that you get vaccinated. And it's been a wonderful opportunity to be here and share our thoughts on what is happening in terms of interventions as well as prevention and rehabilitation. And thank you once again.
Dr. Anantharaman, two more questions are there. So can you see the questions in the question and answer section?
Just
Dr.
read it
Chidambaram has asked.
Read it out.
Yeah. Dr. Chidambaram has asked a question. Is there need for a daily low-dose aspirin or statins above 50 years, even when there is no risk factors?
No, there used to be a belief about that, but not anymore. Now we risk stratify. At least you need to have some kind of risk stratification, whether it's Framingham or there are multiple risk stratifications available. And once we risk stratify, if you fall into that higher risk group of about more than 7.5 to 10% sort of annual risk of event, then probably it's better to take statin and aspirin. Otherwise, the risks outweigh the benefit. Because when statins came, all the Australian physicians started taking it without any sort of risk stratification. So it does have its own downside. And especially if you start taking statins, it kind of exposes you. If you are a pre-diabetic, it will get you into the diabetic state early. So that we have to remember. And aspirin has got its own downside of GI bleeding. So both the things you have to remember. And it's better that you see physician, have risk stratification, then go on aspirin or statin. What is the other question, Saravana?
Yeah, from Dr. SHV, Dr. Shiv. Thanks for the lovely presentations. If the blood tests are abnormal, but the person is healthy with adequate BMI, would you still treat the blood results?
Obviously, if he's meaning the cholesterol, if the cholesterol is high and if he's feeling absolutely fine, then yes, you still need to treat. especially if your LDL is very high, like more than 150 to 200, HDL is low, and triglycerides is high, which is quite common in our population, Asian population. That is the kind of metabolic syndrome we are having: high LDL, low HDL, and high triglycerides. And especially if you have other additional factors along with that, diabetes or hypertension, even if you don't have symptoms, you still need to have it controlled. The numbers need to be controlled because it does stabilize the plaques. And when you have atherosclerosis in the heart arteries or in the carotids or elsewhere, it doesn't matter whether it is 30% or 40%, because even that 40% narrowing can give a heart attack or stroke if that plaque has got a very thin covering. We call it a thin cover or thin thin cap fibroadenoma. So that will rupture. So the statins will make it thicker. So it's better to have it treated. So we're not just treating the numbers, we are also making the cap over that atheroma more firmer and more thicker so that it doesn't rupture and cause a heart attack or stroke.
Yeah, thank you, Dr. Anantharaman. Next question is to Madam. It's from Dr. Francis Sai. Beautiful presentation, Madam. How much smoking is bad? I smoke around 20 in a month.
Thank you for that question. Yes, our smile is saying it all. Any cigarette smoking, any tobacco in any form is completely better, completely avoided. As my father, Professor Chokalingam, would say, each cigarette is like a bullet. So with that, you have the answer to that. Please quit at the earliest. That is the best thing you can do for yourself and for your kith and kin.
Thank you, Madam. Since there is no more questions, so on behalf of Tamil Nadu Orthopaedic Association, I wholeheartedly thank Professor Chokalingam, who is not able to come today, but he has given his recording. It's an excellent message to our doctors community and also for general public. So I thank Dr. Priya Chokalingam and my classmate Dr. Anantharaman for sharing their knowledge. It's a great session. Thank you very much, Madam. Thank you, Dr. Anantharaman.
Thank you, and best wishes to all our friends and colleagues. Thank you.
Thanks to Mr. Vasant Iyengar for the wonderful technological support to Tamil Nadu Orthopaedic Association.
Thank you, sir. Thank you, and very fantastic presentation. Thank you. Take care.
Thank you.
Good night, sir. Good night.
Thanks to all the participants and our office bearers. Thank you very much.
Thank you very much.
Thank you. Good night.